So it's funny, whenever you hear the words wisdom teeth, it's almost always followed by a story about how much they hurt or how awful it was to get them out.
Oh, absolutely. They have a bit of a scary reputation.
Right. So today we're diving deep into all the sources about wisdom teeth, figuring out why they exist, what to do about them, all that good stuff.
Yeah, it's a fascinating topic, and they weren't always the bad guys.
Okay, so wait, are you telling me there was a time when wisdom teeth weren't a problem?
Exactly. You got to think about our ancestors, right? Their diets were way different than ours.
Oh yeah, lots of tough food, like unprocessed stuff, roots and things.
Exactly. So those third molars, that's the clinical term for wisdom teeth, those were essential back then.
Makes sense. I guess you'd need some powerful chompers to grind up all that stuff.
For sure. They needed that extra force to break down those tough foods.
So then why are they causing us so much trouble now? Did something change?
Well, evolution happened.
Oh, right, of course things change over time.
Our diets shifted. We started eating softer foods, more processed stuff.
Plus we cook our food now, which makes a big difference.
Huge difference, yeah. Cooking makes food way easier to chew, so we don't need those powerful jaws and teeth as much.
Ah, so basically our jaws got smaller over time because we didn't need them to be so big anymore.
That's the gist of it, yeah. And that smaller jaw size, it means there's less room for those wisdom teeth to come in.
And that's where the trouble starts.
You got it. When there isn't enough space for those teeth to erupt properly, they can become impacted, meaning they get stuck.
Our sources talked about 4 main reasons why extractions are often necessary.
Oh, yeah, the big four: impaction, crowding, infection, and cysts.
Can we break those down a little bit more, starting with impaction, since we were just talking about that?
Sure, so as we said, impaction happens when the tooth gets stuck, basically.
Okay, and what about crowding?
Even if a wisdom tooth manages to partially erupt, it can still cause problems.
How so?
Well, it can push against the other teeth, the ones that are already there and all nicely lined up.
Oh, so that's why some people need braces even after their adult teeth have come in, those pesky wisdom teeth, messing things up.
Could be, yep. Then there's infection, which is another big one.
Right, because if the tooth isn't fully erupted, that creates a perfect little spot for bacteria to hide, doesn't it?
Exactly. It's like a little trap in your mouth, just collecting all sorts of gunk. And that can lead to gum disease or even cavities.
Yikes, that's not good.
Definitely not. And lastly, there's the possibility of cysts.
Cysts?
Yeah, or even tumors forming in the jawbone around an impacted wisdom tooth. It's not as common, but it's a risk.
Wow, I had no idea wisdom teeth could be so serious.
Oh yeah, they can cause some real problems if they're not addressed.
It sounds like regular dental checkups are super important.
Absolutely. Any concerns about wisdom teeth should always be discussed with a dentist.
So what happens if someone, actually needs to have their wisdom teeth removed? What's that whole process like?
Well, the first step is a consultation with an oral surgeon.
Okay, so you go see the specialist.
Right. They'll take x-rays to see exactly what's going on with those wisdom teeth.
So the x-rays are like a roadmap for the surgeon.
You could say that, yeah. They help the surgeon figure out the position of the teeth, how impacted they are, and what the best way to remove them is.
And then what? What happens after the x-rays?
Well, then the surgeon will decide what type of anesthesia to use.
Anesthesia, you mean like going to sleep for the surgery?
That's one option called general anesthesia, but sometimes they can just numb the area that's called local anesthesia.
So how do they decide which one to use?
It depends on a few things, like how many teeth are being removed, how impacted they are, and the patient's overall health. More complicated extractions usually mean general anesthesia.
Okay, that makes sense. And then the actual extraction.
You won't feel a thing during the procedure because of the anesthesia. They'll carefully remove the teeth, and if it's impacted, they might need to break it into smaller pieces to get it out.
Break the tooth. That sounds intense.
It's not as scary as it sounds, I promise. It's all done very carefully, and again, you're numb, so you don't feel it.
Okay, not to know. So how long do the whole thing usually take?
It usually takes about 30 to 60 minutes.
Not too bad, all things considered. But what everyone really wants to know is, what about recovery?
Oh, yes, recovery. Everyone's favorite topic.
Right, all those funny stories about people saying weird things after anesthesia, and of course the infamous chipmunk cheeks.
Those are definitely part of the wisdom teeth experience. But first, let's talk about what you can expect in those first few days after surgery.
Okay, what should people be prepared for?
Some swelling is totally normal, and yeah, you might get that chipmunk cheek look.
Ice packs are key, right?
Absolutely. Ice packs will be your best friend. They help with both swelling and discomfort.
And what about eating?
You'll be on a soft food diet for a while, things like yogurt, soup, mashed potatoes, that kind of thing.
Nothing crunchy or chewy?
Definitely not. You don't want to irritate the extraction sites.
That makes sense. No chips and salsa for a few days, bummer.
It's a small price to pay for a smooth recovery. And of course, ice cream is a must.
It's practically a ritual.
But the most important thing is to follow your surgeon's instructions.
Oh yeah, that makes sense. It's easy to get caught up in the excitement of ice cream and forget about the boring stuff.
Right. Make sure you're taking any medications they prescribe, avoid using straws, and keep up with your oral hygiene.
No straws, huh? Even for milkshakes.
Especially for milkshakes, straws can dislodge the blood clot, which can delay healing.
Got it. No straws. So basically, soft foods, ice packs, and lots of rest.
You got it. Your body needs time to heal, so give it a break.
We've got some great listener stories and FAQs to get to in the next part of our deep dive.
Yeah, it's always interesting to hear about other people's experiences and clear up some common concerns.
That's where it gets really relatable. Stay tuned because up next, we're diving into real-life wisdom teeth tales and answering those burning questions you've always had.
All right, so you ready for some real-life wisdom teeth stories?
Oh yeah, hit me with them. Everyone's got one, right? I'm always curious how different people's experiences are.
Well, one listener wrote in about their encounter with anesthesia.
Oh, is this the one where they thought their dog turned into a unicorn?
That's the one. They were totally convinced, like completely sure their dog had transformed.
And the surgeon actually got it on video, right?
Oh yeah, they recorded the whole thing.
Oh, that's amazing. I can't imagine having that video just rambling about a unicorn dog.
It makes you wonder what really goes on in our brains when we're under, doesn't it?
Seriously. Okay, what other stories do we have?
So this next one, it's not quite as funny, but it's definitely relatable.
Okay, lay it on me.
This listener, they said the hardest part of the whole experience was the food.
Oh yeah, the food restrictions. I totally get that.
No chips, no crunchy snacks for a whole week. That's tough.
It's like torture.
It's definitely a test of patience, but those restrictions are there for a reason.
Oh, for sure. You don't want to mess up the healing process by chomping on something you shouldn't.
Exactly. Okay, ready to tackle some of the most frequently asked questions about wisdom teeth removal?
Bring them on. Let's clear up some of the mystery and anxiety around this whole thing.
Sounds good. So first up, the question everyone wants to know, does it hurt?
The million-dollar question.
Well, during the procedure, you won't feel a thing thanks to the anesthesia.
Okay, that's a relief.
But you will likely have some discomfort and soreness afterwards, which is totally normal.
So, like, how bad are we talking?
It varies from person to person, but your surgeon will give you pain meds to manage it.
Okay, that makes sense. What about, like, how long does it take to recover? When can you get back to normal life?
Most people start feeling much better within a week,
Okay, not too bad.
but full healing can take a few weeks.
So, no marathons or anything right after surgery?
Probably not the best idea. All right, next question. This one's interesting. Can you keep your extracted wisdom teeth?
Ooh, yeah, I've always wondered about that.
It depends on the surgeon. Some will let you take them home if you want.
It's like a souvenir?
I guess so. Some people think it's cool. Others find it kind of creepy.
Yeah, it definitely depends on your personality. Okay, real talk for a second. A lot of people are super anxious about getting their wisdom teeth out. Any advice for them?
I'd say it's a really common procedure.
Yeah, it seems like almost everyone gets it done at some point.
And with proper care, most people recover just fine.
That's reassuring.
Just talk to your dentist or oral surgeon about any concerns you have. They can answer all your questions.
Communication is key, right?
Absolutely. So we've talked about the history of wisdom teeth, why we might need them out, what the procedure's like, and even recovery.
It's been a real deep dive.
It has, but if we zoom out a bit and look at the big picture, it's pretty fascinating how evolution has led us here.
What do you mean?
Well, our diets and jaw structure have changed so much over time, and now we have these wisdom teeth that often cause more problems than they solve.
Makes you wonder what'll happen to wisdom teeth in the future, right?
Exactly. That's actually a question we'll leave you with. Think about it. Could wisdom teeth eventually disappear altogether?
A world without wisdom teeth trouble. That's a nice thought. But in the meantime, what does all this mean for our listeners who are dealing with this right now?
I think the takeaway is knowledge is power.
Knowledge is power, yeah, but what does that actually mean for people dealing with wisdom teeth?
Well, it means understanding, why you have these teeth in the first place.
Okay, so knowing the history.
Yeah, and what problems they can cause and what your options are.
Right, so not just blindly accepting that they have to come out.
Exactly. Talk to your dentist, ask questions, do your research.
Arm yourself with information so you can make the best decision for your own health.
You got it. And remember, millions of people go through this. It's a super common procedure.
Yeah, that's good to remember. You're not alone in this.
And with proper care, most people recover without any major issues.
That is definitely reassuring to hear. It's amazing, though, how much those personal stories help.
Oh, for sure, those real-life experiences can make all the difference.
Like, it's one thing to hear the fact I'm a dentist, but it's another to hear from someone who's actually been through it.
Yeah, it makes the whole thing feel less scary, more relatable.
Like, okay, I might get a chipmunk cheek, but at least I won't think my dog's a unicorn.
Haha, exactly. It helps to keep things in perspective. It might not be fun, but it's usually manageable.
And hey, maybe someday it won't even be a thing anymore.
Right. Future generations might not have to deal with this at all.
That's a wild thought. Well, I think we've covered pretty much everything there is to know about wisdom teeth in this deep dive.
We've gone from their ancient history to modern day solutions. It's been quite a journey.
Hopefully everyone listening is feeling a lot more informed and maybe a little less scared.
It's been a pleasure chatting about this with you.
And to all our listeners, keep those pearly whites sparkling, and remember, knowledge is power.
Thank you for tuning in. You can find our office number in the description below and/or on our thumbnail.